clearly that Africa is currently in a situation where there's a high burden of cases. There are far more cases now than there were when the WHO declared a public health emergency of international concern in 2022. In fact, if you look at the period, the most recent period, the number of cases in Africa is more than triple what it was when the peak was declared in 2022. So it's very clear that we are now dealing with a different situation, a situation where the cases are far more than we've seen in the past year and in the past 2 years. So we have a high burden of cases. The third point we made is that the number of cases being reported are increasing. What we have been seeing in the last few weeks is a rapid increase in the number of cases that are being reported. And this upward trend is quite concerning. So it's not just that we have a lot of cases, they are increasing in addition. The fourth point we made is that the case fatality rate, the proportion of diagnosed cases that go on to a negative outcome of death is at a level that we would consider too high. And the current case fatality rate ranges between 3 and 4%, depending on the period you take and the criteria you use. That's higher than we should expect from a condition like this, but we also understand the limitations in the data in doing this calculation. But our bigger concern is that there seems to be an association in the evidence we have between having immune deficiency due to HIV and a fatal outcome from MPOX. And if that's the case, we have to be particularly concerned in Africa because of the HIV burden that we have. So our concern is that we may be seeing more fatalities in Africa because of the association with HIV. So I'm going to go through very quickly the first 4 points we made. We said that we understand the limitations in the evidence. The second is we have a high burden of cases. The number of cases are increasing, and we have a fatality rate, and we're concerned that that fatality rate might even increase because of the association with HIV. The next set of recommendations or points we made dealt with the spread of this virus. And that is that we're now seeing new countries that haven't had cases in the last several months. They are now reporting cases. And that is a concern, that we now have cross-border transmission, and the virus is now moving into countries where it hadn't been before. And so that was a concern. And it doesn't seem to be, the evidence we have does not seem to be that it's zoonotic transmission. In other words, from an animal reservoir, it seems to be almost all or mostly from human to human transmission. So we are seeing new cases in countries that didn't have cases before, and that's a concern. And we felt that there's a need for greater coordination of the response, that we need to ensure that the disparate attempts that are being made are brought together in an overarching plan with some coordination to improve the efficacy of our intervention measures. And so that was the sixth point we made. The seventh point we made is that while vaccine access is limited, we need to be circumspect because the vaccines are expensive and the benefits of the vaccine are not entirely clear in terms of general use of the vaccine. We have to be very strategic in who we use the limited number of vaccines on. And, for example, healthcare workers have been one of the groups that have been at risk, and to approach it from the point of view of individuals who are at high level of exposure, for example, household contacts of people who are diagnosed with MPOX, would be candidates for vaccines. We also have a real challenge, and that was the 8th point we made, that we do not have enough diagnostic capability. For example, in the DRC, many of the cases that are being reported clinically. We do not have a lab result on over half of all the reported cases. So we need to do better in terms of making diagnostics available and making them available so that we can implement public health measures. And the public health measures is case identification, contact tracing, isolation. Those elements by themselves can bring MPOX under control. And the final point we made, the 9th point, was that we encouraged the Africa CDC to develop a response plan in which we would be happy to review it and provide our own experiences and advice to assist the Africa CDC in its global response. So those were the 9 points we made. And on the basis of that, the proposed resolution was then supported unanimously by all 16 of the committee members, the ECG, that were members who were present. And that is that we resolved unanimously to make a recommendation to the Director General of the Africa CDC to declare MPOX a public health emergency of continental security. And with that, I'll hand back to you, DG.
Thank you so much, Professor Salim, on behalf of ECG members. Excellencies, colleagues, members of the media, and my fellow African citizens. Today, I stand before you with a heavy heart, but also with an unwavering resolve. We are meeting today because of the emergence and rapid spread of MPOX. This is not just another challenge. It's really a crisis that demands our collective action, a moment that calls upon the very essence of our humanity, our unity, and our strength. Our continent has seen many struggles. We have faced pandemics, various outbreaks, natural disasters, and conflict. Yet, through every adversity, we have risen, not as fragmented nations, but as one Africa, resilient, resourceful, and resilient. Today, as we confront the threat of MPOX, we must summon the same spirit of solidarity. But let me be clear, this is not just an African issue. MPOX is a global threat, a menace that knows no boundaries, no race, no creed. It is a virus that exploits our vulnerabilities, preying on our weakest point. And it is in this moment of vulnerability that we must find our greatest strength and demonstrate that we are all learning from the COVID lesson and we are playing solidarity. Excellencies, colleagues, my African citizens. Article 3, paragraph E of the Africa CDC statute, approved by African leaders in July 2022, is stating Africa CDC declares public health emergency of continental security in close consultation with affected member states and as appropriate relevant stakeholders. Africa CDC is the autonomous public health agency in Africa. and we bring together the scientific, strategic, and political aspect of our work. In Africa CDC, we are led by science and evidence for everything we are doing and decisions we are making. Therefore, we started consultations with several bodies in Africa and the world. At scientific and technical level, we had meetings with various bodies and people who are known as experts in the world. But these people, they are working pro bono and tirelessly for our continent. And the only way for me as Director General to thank them is to recognize them officially. From the emergency consultative group, we have Professor Salim Abdul Karim, the chair, who just provide the summary of the meeting that they have. We have other professors and doctors like Hélène Ries, David Parire-Niatois, Lucille Bloomberg, Jean-Jacques Mouyembe, Francine Toumi, Roseleke Fonbank, Jean Nachega, Amadou Sall, Tomori Oyewale, Sambaso, Dimi Ogoina, Maroufi, Mawa El Rabat, Samia Menif, Faizi Dera, Sultani Matendeshero, Nelson Siwakambo, Claude Mambo Muvuni, and Agnès Binagwao. Our African senior experts were also supported by other international and friends of Africa, like David Heyman, Francis Collins, Peter Piot, Dr. Sangotak, our European CDC colleagues, Mario Santos from Fiocruz in Brazil, and Jeremy Farah from WHO. The ECG was not the only body that advised the Director General on technical issues. We also said, let us consult more. We consulted the PPPR Commission. This is the Pandemic Preparedness and Prevention Response. That is advising President Ramaphosa of South Africa as the African champion for pandemic preparedness, prevention, and response. Under this commission, we also have people working tirelessly for the continent, like Mawa El Rabat, Amafeni, Senait Fiseya, Gitinji Gitai, Denis Mukwege, Abdraman Maroufi, Sani Aliyu, Agnès Binagwao, Francine Toumi, and Amadou Sall and Salim Abdul Karim. In addition to these two strong technical bodies, Africa CDC has also what we call a governing structure, advisory and technical council. This advisory technical council had also a meeting, and they made guidance that was also provided to the ECG for the appropriate guidance to the Director General. I want also to recognize Eduardo Sado Gudo, Alex Oko, Anne-Marie Ambouret, Bigman, Patrick Amot, Roma Chilengi, Joseph Nyanzi, Dionis Nzigi Yimana, Claude Mambo Muvuni, Quinta Isumbo, Abdulmen Al-Mash, Jean Akiana, Mohamed Al-Sour, Khadija Yusuf, Rose Mwebaza, Adamu Issa, James Wabasha, Karim Tunkara, Francis Kasolo, Thomas Mollet, and Maroufi. All of these experts were joined also by others from National Public Health Institute, the meeting that we had with all of them to get a sense of urgency and also what they are doing to contain this outbreak. We thank all leaders of National Public Health Institute and Public Health Emergency Operation Centers from all African countries who attended various meetings that we had. We also had meetings with the private sector, including manufacturers of vaccine and diagnostics. But we didn't neglect youth movement and organizations. At technical level, these are all bodies that we consulted. But we didn't stop there. We went at strategic level. We had a meeting with what we call the Joint Emergency Action Plan. This is a mechanism putting together Africa CDC, the Director General of the Regional Director of WHO AFRO, the Regional Director of WHO EMRO, the Regional Director of UNICEF ESARO, Eastern and Southern Africa, the Regional Director of UNICEF WECARO, West and Central Africa, the Regional Director of UNICEF EMRO, supported also by their HQs. This meeting took place with resolutions made. We had also a meeting with the African Union Joint Sitting Committee that is representing all ambassadors on behalf of the Permanent Representative Committee. This is the meeting that facilitated to release the 10.4 million we shared with you last time. We had also a meeting with the governing board of Africa CDC under the leadership of the new Minister of Health of Zambia. This meeting was bringing together ministers, key partners, and the African Union Commissioner for Health, Humanitarian, and Social Affairs, my sister, Minata. We also had many other engagement and meetings with various partners, including the Director General WHO, my brother, Dr. Tedros, the UNICEF Deputy Executive Directors, the Gavi, Global Fund, CEPI, Mastercard Foundation, Wellcome Trust, Bill and Melinda Gates Foundation, World Bank, Afrexim Bank, Africa Re, African Development Bank, and so many other partners. Then, after the technical level and the strategic level, we had also engagement at political level. We had meetings with ministers of affected countries and other countries at risk. We had a briefing to the chairperson of African Union Commission, His Excellency Moussa Faki. Then we got also guidance from the president of Mauritania, who is the president of African Union, representing all head of states in Africa, His Excellency Mohamed Ould Ghazouani. From all of these consultations, at least 600 people were reached in various capacities to discuss data and evidence and to provide the way to move forward for this outbreak. Let me be clear and loud. Africa CDC didn't sit in its office and make a decision. No, it was a consultative process laid at various levels by capacity people. And as demonstrated by Professor Salim, MPOX has now crossed borders, affecting thousands across our continent. Families have been torn apart, and the pain and suffering have touched every corner of our continent. Based on the consensus or even unanimity reached from various bodies and consultations, as prescribed by Article 3, Paragraph E of the Africa CDC Statute, today, Tuesday, 13 August 2024, I declare with a heavy heart, but with an unyielding commitment to our people, to our African citizens, we declare MPOX as public health emergency of continental security in Africa. Excellencies, colleagues, and my fellow African citizens, this declaration is not merely a formality. It's a clarion call to action. It's a recognition that we can no longer afford to be reactive. We must be proactive and aggressive in our effort to contain and eliminate this threat. This declaration aims to enhance the global response, mitigate the impact of the health threat, and protect public health while minimizing disruptions to travel and trade. Please let me be clear and loud. Africa CDC will never, at this moment, with the evidence that we have, advise for interruption of movement of people and goods. Movement of people and goods will continue as it was in the past, while we are giving ourselves the tools to fight this outbreak. Article 3, paragraph F of the Africa CDC statute is giving Africa CDC the mandate to lead and coordinate the response when there is a declaration of a public health emergency of international concern or public health emergency of continental security in Africa. Please let me read this paragraph F. Coordinate and support member states in health emergencies response, particularly those which have been declared public health emergency of continental security or public health emergency of international concern emergencies, as well as health promotion and disease prevention through health system strengthening by addressing communicable and non-communicable diseases, environmental health, and neglected tropical disease. End of the quote. During the consultation process, Africans and friends of Africa clearly shared with us the way they were proud to see a strong and capable African body taking the lead for this outbreak and protecting African population. We are also clearly requested to work together and coordinate support from other key partners like WHO, UNICEF, bi- and multilateral cooperation, private sector, philanthropies, and academia. We declare today this public health emergency of continental security to mobilize our institutions, our collective will, and our resources to act swiftly and decisively. It empowers us to forge new partnerships, to strengthen our health systems, to educate our communities, and to deliver life-saving interventions where they are needed.